Good afternoon, you guys. My name is Ray Sebastian. I'm going to be going over transfers with you guys, okay? Safety transfers and bed mobility. That's going to be our subject for the day, all right? First thing we want to do before we enter our room and we're coming to go see a patient, what do? Knock. Exactly. We knock on the door, introduce ourselves, and then come in, okay? And that's going to play a role too in that part of talking with the patient and relaying the information. As we're doing anything regards to transfers or anything that we're dealing with the patient, we always want to explain what we're doing. Introduce ourselves, tell them step by step what we're going to be doing so we can get them involved and also understand what we're doing, so that's going to reduce some of the anxiety that they're feeling when they're trying to do something. When they know what they're going to do, it helps, right? Okay. So every patient is different. So we have precautions, right? Every patient has different precautions. You guys, you should know the different precautions that we have with different patients. We have hip precautions. We have spinal precautions. We have strokes patients where they have one side that's weaker than the other. We also have patients that have weight bearing status, so sometimes they can't put weight on that leg or they can't put weight on their arm, okay? So when you're dealing with a patient, make sure you know and identify that before you start working with the resident, because that's going to define how you interact with the patient, okay? That's going to tell us where we can grab, where we can, position and so forth, okay? We always want to try to go towards the unaffected side or the stronger side, okay? So when we're doing a transfer, which side do we want to go out to? The strong side, right? Or the unaffected side. For example, our stroke patients, we have Betsy, right? She's our stroke patient. She has a stroke, and on her right side is her weakness, right? So this whole side of her body is totally flaccid, not able to move, not able to help us, right? So when we're doing a transfers, which side of the bed do we want to come out of? That side. Got it. You guys are smart. Okay, so first, I'm going to just kind of go over positioning and how to handle a patient, okay? Then we'll do the transfer. We always start with the patient in bed, right? And usually the bed is at the lowest position, right? We always put the bed in the lowest position, and we keep the collet next to them, and so forth. So when we're approaching the patient and they're at the lowest position, you think it's good for us to start trying to handle them and do that? No. So we should adjust the bed to the proper height where it's good for our backs and it's comfortable for us, right? So I'm going to go ahead and do that first. Let's hope this bed works. And unplugged, yeah. Scratch that. Well, we want to make sure the bed is plugged, right? All right, let me move the bed back a little bit. Sorry, guys. Okay. There we go. So now I'm going to adjust the bed to the height. And we're all different. Some of us are vertically challenged like me. Some of us are tall. So, you want to adjust it to where your height is comfortable, okay? So when we're handling the patient, where do you guys think the best place is to, when you're trying to roll them to the edge of the bed? Where do you guys think would be the best place to hold them? Do you think doing this is good? No, right? The best placement for handling a patient, I wrote it up there, is the shoulder blade and the pelvis area, okay? So go ahead and to your neighbor, go ahead and get that area, get familiar with it. That's your area, okay? So you're gonna find the shoulder blade like this, get your hand over there, find the pelvic area right here, okay? Those are good areas to hold on to where you can't hurt the patient because they're strong bony areas and you can easily turn, okay? Because a lot of times, sometimes when we're in a hurry, we may pull on the arm or do other things, all right? So make it a habit of using that, okay? You also have the chucks. The chuck is also a great thing, but we're not gonna always be able to use that, right? Especially when we're changing the diaper, because if you're changing the diaper and you're using the chuck, you're pulling the chucks with you, right? And you have to put the diaper in between that, right?
Mhm.
So then using that area to transfer the patient is always the best place, okay?
Okay.
Right here in the shoulder blade, right here in the pelvic area, okay? So that's how we would transfer the patient towards the side, okay? When they're able to help, it's great, because you can ask them to help you. When they're not able to help, you're doing a lot of it on your own, right? So in this transfer, I'm gonna have her help, okay? And the next transfer, I'm gonna have her not be able to help, and I'm gonna have one of you guys help me transfer her into the chair, okay? So for this example, remember, this is her weaker side, this is her stronger side, okay? So what side of the bed am I gonna come out of?
The left side.
Okay. So I'm gonna go out that way. And this transfer, she's able to help us, okay? So I'm gonna, as much as possible, ask the patient to help. All right? So Betty, we're gonna be coming out of the bed, okay? I'm gonna transfer you towards this side. I want you to help me as much as possible, okay? You see the bed railing right here? Okay, when I'm transferring you over to this side, I want you to reach for the bed railing, okay? Can you reach for it now or not yet? Okay, hold on to it. You got it? Okay. Go ahead and bend this leg. Okay, and the count of 3, let's roll over to the edge of the bed. Okay, 1, 2, 3, roll. Good. All right, now go ahead and bring your legs over to the edge of the bed, all the way to the up. And then when you're sitting them up, same thing, pelvic area, shoulder blade, but I'm gonna come in underneath like this, right? Never around the neck. You know, sometimes we have a tendency to put our hand around the neck like this. Don't do that. Get a hold of the pelvic area, right there. She's gonna help, remember, she can help me, all right? So, Betty, I want you to push down with your elbow and push up with your arm on the count of 3, okay? 1, 2, 3. So she helped me, right? The other trick is raising the head of the bed, okay? That's another trick that you can do, is have her lay, go ahead and lay back down with me, and then raise the head of the bed up like that, and she's already halfway up, okay? And then have her help, go ahead and push up, 1, 2, 3, so forth. Sometimes if there are a lot more assists, then use the bed to help you, okay? For this example, she's able to help us, so that's all we have to do. You're able to help, stop. Later, you can be that way. If they're able to help, they should be able to hold themselves up at the edge of the bed, okay? And you would be able to know. So the next part is setting up the wheelchair to the patient, okay? As much as possible, we want to get the wheelchair as close as possible to the patient. Do you want the chair to be like this, or do you want the chair to be more like this?
Like that.
Okay, perfect, yeah. Oh, you guys are so smart. Okay, there's another problem, right? Do we want the legs dangling? No, right? We want the feet on the ground, all right? So the easiest way to do this transfer is having the bed to the wheelchair in more of a downslope angle, because you're going from higher to lower surface. On the way back, you want the wheelchair and the bed to be the same level, okay? Because you don't want to transfer to a higher surface, but it's easier to transfer to a lower surface. Does that make sense?
Yeah.
Okay. So I'm going to adjust the bed a little bit. I'm going to have Betsy kind of scoot over a little bit. Can you scoot over a little bit more towards me? A little bit of an angle. Good, right there. So you see how she's already at a 45-degree angle? 50% of the transfer is already done because she's at that angle, and all you got to do is do a pivot, okay? So Betty, can you hold on to this? And then I like using a gate belt. And I hope you guys get a habit of using a gate belt too, because it's something that's safe for you and the patient. And it's a place for you to hold on to, okay? So I would put the gate belt on. And when you're doing a transfer, you always want to have a wide base support. You want to avoid any twisting. Okay, if you're going to do any turning, you're going to be turning with your feet, okay? That feet motion, okay? And another thing you want to do is your center of mass, you want that close to the patient's center of mass. So you guys are both one unit when you stand and transfer, okay? But in this case, she can help. So, just ask her to help you as much as possible. So Betsy, let's go ahead and transfer 1, 2, 3, 1, and she sits. That's it, okay? Now we're gonna do a two-person transfer. And who can help me? Who wants to do it? George, you're volunteer. Come on. Okay, go ahead and lay down. Just keep it on. It's fine. So we're going to do a two-person transfer, and specifically, she is a stroke patient. She is not able to move her right side, okay? The first thing we want to do is position the patient for the transfer, and that's handling the stroke side. Go ahead and come over to the other side. Okay. When you're doing a two-person transfer, you want to communicate with each other as much as possible. You know, counting out 1, 2, 3, transferring together, moving the patient together. Usually one person takes the lead, okay? I'll be taking the lead at this, for this transfer, okay? So she's a stroke patient, meaning that she's not able to use this side of her body at all. So remember, just be dead weight, okay? First thing we want to do is handle her stroke side and position it for the transfer. What we want to do first is get her right arm, bring it towards her like this. If they can help, ask her, can you hold your right arm? So they can maintain that, okay? Then, for the legs, you want to bend it, bring it up like so. All right? So now that you got that, she's all bent, we're going to transfer over to me, okay? So I want you to help me bring her over like this. Go and hold on to that, get the hips right here. I'm going to get her from here. And you see how my arm is holding that leg? It's stopping it from coming down or moving to the side. With Betsy, she has a tone, so what ends up happening is this leg will pop out sometimes, okay? And then by me putting my other arm right here, I'm also stopping that arm, okay? So we're gonna roll towards me. And count of 3. 1, 2, 3. We're rolling her over like this, okay? We're holding it like that, okay? So next thing I'm gonna do is bring this leg over already to the edge of the bed and slide it. There, and hips right here. We're gonna sit her up, okay? Same thing, get a hold, control the hips. 1, 2, 3, good. And sit her up, just like that. Can you hold her for me while I get the wheelchair ready, okay? So she's at the edge of the bed, you know, she's dead weight, so forth, okay? I'm gonna get the chair set up for the transfer. Okay? And now that she's here, go ahead and come over here. And the person should be here, the second person, okay? Can you put this down right here? It'll be out of your way, okay? So what the second person is doing is they're helping with positioning the pelvis towards the transfer, okay? The person in front is going to be doing majority of the transfer by lifting, all right? So before we even transfer her, I want to get her a little bit more, we're going to lean forward and position like that, okay? And you want to get your legs in between. See how my legs are between her? Especially for Betsy, her legs kick out. Okay, so get your legs in between, lean the patient towards you as close as possible. See how I'm really close? And I have my hands right here, and I'm holding that arm from not moving. Okay, you ready, George?
Yeah.
1, 2, 3. There you go. That's it for two-person transfer. I'm sure you guys done this all before. It's just a matter of just making it a habit. Do you guys have any questions?